Today, our first guest we have with us, we have Dr. Brad Abrams, and we're going to be talking about non-surgical cosmetic treatments and how they're growing in popularity. Welcome to the program, Dr. Abrams.
Thank you.
Now, the different treatments opportunities that you offer, obviously people want to be able to maintain or recapture their youth. A better outer image is great for self-esteem, and especially, a lot of studies have shown, especially in this economy, I mean, that is the one area that people are really addressing because, job opportunities. I mean,
it's not just the opportunity, it's just maintaining your job. You just want to look good and you feel good. So what's nice about the newer techniques is that we can still do the technique and get great results, and the patients can still go to work the next day. And really, you don't see significant side effects with the techniques today. They don't have to be out for 2 or 3 weeks. There's a newer technique called subablative laser. It's actually not a laser per se, but the treatment is for patients with fine lines, skin laxity, acne scarring. It helps with the complexion, and it's a non-laser based treatment. And the way the treatment works is it bypasses the epidermis, so therefore it's not going to damage the outer envelope of the tissue, and it goes right to the dermis and increase fibroblastic activity and collagen production. So it really will improve the laxicity of the skin, the complexity, just a smoother feeling of the skin, and it looks phenomenal. The newer treatment, the subablative treatment, it bypasses the epidermis, does not damage the epidermis. It goes right down to the dermis. It's actually a radio frequency treatment, and it stimulates collagen production, and it's really phenomenal with fine lines and wrinkles.
In today's society, people want the magic bullet. They want instant results. How quickly can they achieve these results? First, we'll talk about the affordability because, in many cases, if you can afford all the rounds of treatments that are recommended, and you should be, doing that, is great. But sometimes people want to be able to span it out. And how long do these treatments last?
Yeah, it just depends on what treatment you're going to have. But I'll just take the subablative radiofrequency device. Typically, it takes anywhere from 3 to 4 treatments. The treatment's about 6 weeks apart. And you start seeing results pretty much within 24 hours. So your skin will have a smoother appearance, smoother complexity to it, more of a radiant shine. Now, once the radio frequency hits the dermis, it starts stimulating fibroblasts, which increase collagen production. And then you start seeing results as far as decrease in acne scarring, decrease in skin lines. And that takes about 4 to 6 months to see the results. So you have to be patient with it. That's not instantaneous. But pretty much within the next couple of days after treatment, the first treatment, your skin really is smoother and it looks more radiant, and patients are really happy.
Now, I would imagine after these treatments, there's certain types of applications that your office might want the patients to be able to place on their face, whether it's some type of a cream base or, something more nourishing for the skin. Do you address, those types of issues as well?
Yeah, absolutely. It's the way I look at the skin is a full gamut type of procedure. There is no way that I can improve your skin significantly with a radiofrequency device, a laser, any other technology, and just leave it alone. It's a maintenance. So you have to use sunscreen, which is really key. You have to use really good products. I have all my patients on tretinoin, which is Retin-A, hydroquinones. It just depends on what the patient problem is, but it's a maintenance, and it's a forever maintenance. Now, as far as laser treating other areas of the body, I have different lasers, like I said before, for different skin conditions. One laser is called a V-beam laser, and that treats blood vessels on the face, redness, blood vessels, patients with rosacea. I can also use it on the leg veins for very small superficial leg veins, and it works quite well for leg veins. I think one of the biggest things I've seen is the rise in the male population coming to have more cosmetic procedures, as well as the demand for all my patients not to have any downtime. We want it all. We want to look great. We don't want to have any downtime. We don't want anyone to know that we had anything done. And we want to have a refreshed look. The sublative radio frequency technology is really colorblind. It really doesn't matter what shade you are, what color you are, if you're darker skin, lighter skin, medium skin, it doesn't see color, and it does not damage the epidermis. It goes right into the dermis. So it's phenomenal, and it has opened the market to a lot more patients, because in the past, the light-based laser treatment would actually damage the epidermis and cause sometimes permanent hyperpigmentation, just dark spots. And they would leave the practice looking worse. So the newer techniques and technology is really wonderful for all skin types. As far as cosmetic procedures, don't be afraid of them. They don't hurt. They're not that costly at all. They're affordable. And the results really are significant. So it's not like you're going to see a teeny bit of change. You're going to see a significant change, and you're going to be happy. And it's a lifelong commitment. It's not you have one technique, one procedure, and you're finished. It's a constant. This whole aging process is a constant battle. So really look into it, and don't be afraid.
Well, we're very excited to be able to have shared your information here on the air. AbramsDerm.com. You can go there for more information.